Good afternoon, everybody. Nice to see you back. Maybe some of you remember that I asked you the first day how positive you are over AI, and do you think it will revolutionize healthcare? Now, after 3 days, you have had a lot of information. Maybe I have a little bit more light in the room? A little bit more light? That's a lot of light. So raise hands if you are still so optimistic. It's a little bit less than in the beginning of the week. Okay. But you can look, you can lower down the light again. What we noticed today, that the role of nurses is very important in healthcare and innovation. And today we have, well, she was a nurse, but she's also an entrepreneur. She is a true advocate of the role of nurses in healthcare innovation. And she's now active in a variety of organizations. One of them is that she's at the moment Chief Clinical Officer at Connect RN. But she's also the co-founder of an organization who is recognized by the United Nations. And that is SONSIEL. It is the Society of Nurse Scientists, Innovators, Entrepreneurs and Leaders. So a big applause for Rebecca Love from the United States. Please, the floor is all yours.
Thank you. Hello, everyone. I think everybody in this audience knows who this person is. Anybody who does not know who this is? No, so if you guys were like me, this is Florence Nightingale. And when I was in nursing school, I kept thinking to myself, could there not be someone in 200 years of nursing history, possibly just a little bit more relatable than Florence Nightingale to nursing today? And as life happens to have it, when you have something wrong with karma, it will come back and smack you in the face in the most unusual of times and moments. And that happened for me when I was at a book fair with my 10-year-old daughter, and we came across a book on Florence Nightingale. And she said, "Mom, there's a book on a nurse. Can we read it?" And I thought, oh, this is going to help us go to sleep tonight. So we brought the book home that night, got ready for bed. We started reading the book. And as she fell asleep, I kept reading. For this was a story I had never heard about Florence Nightingale. And it's a story I want to share with all of you now. It was the year 1854, and the British government was entrenched in a bloody battle called the Crimean War. Now, at that time, women were largely uneducated, but Florence Nightingale had come from a wealthy family. And upon going and graduating university and witnessing this war, she decided to go to the front lines of this battle. Upon arriving, what she witnessed inspired her to pen a letter to the British government in which she wrote, "If you had wanted to create a place worse than hell, you have thus succeeded." For what she witnessed was that those soldiers were not dying from the injuries they sustained on the battlefield, but appeared to be dying from the death and the disease that followed the physician from the bedside to the bedside to the bedside, as he did not wash his hands nor sterilize his medical equipment. Now, at that time, germs were thought to be simply a figment of one's imagination. If you could not see it, it did not exist. So Florence Nightingale had to be meticulous in her research and her documentation to prove that washing one's hands and sterilizing medical equipment not only saved patients' lives, but it stopped the spread of disease. And still, in 200 years of nursing history, there has never been a better innovation to stop the spread of infection than what Florence Nightingale proved. But somehow, in 200 years of history, we have forgotten that nursing started with innovation. Florence Nightingale did not found an independent profession of nursing to be the handmaiden of our physician counterparts. Florence Nightingale founded nursing to challenge the status quo. Florence Nightingale founded nursing to challenge conventional medical practice and to drive forward the outcomes for patients led by nursing care, not to be determined by others, but to be determined by ourselves. But we don't know that because so much of what we learn is absent of what nurses have contributed. I always wondered, was it really 200 years that nothing had happened? Well, not only me, but one of my Nurse Innovation Fellowship students also decided, what happened in 200 years of history? And they founded this project called Nurses You Should Know. And what they found was that there is this collective memory of nursing. There was the Crimean War, there was Florence Nightingale, and boom! 200 years later, here we are, and nothing remarkable has happened in nursing history in 200 years. But there was memory, and then there was history. And nurses have been making history for generations, but had gone unwritten. So let me tell you a little bit about some nurses you may not know. The first picture is of Mary Seacole. Mary Seacole was a Jamaican nurse who also, during the Crimean War, went to the front lines of the battle. Because she was black, she was denied working with Florence Nightingale's group, but established an inn close to the front lines in which she would ride out and take care of injured soldiers and bring them back to care for them, and using Jamaican medicine, helped cure and heal many. Just 5 years ago, the United Kingdom recognized her and erected a statue in her honor. Mary Seacole was a nurse. This next image is of a woman of Sojourner of Truth. During the time of American slavery, Sojourner of Truth was one of the leading abolitionists to fight against slavery. But not only an abolitionist, she fought for women's rights and was the first nurse to testify in front of Congress for normal nursing training. Sojourner of Truth was a nurse. Clara Barton was the nurse who, after witnessing the Civil War in the United States, recognized that soldiers were still living in deplorable conditions. And she went on to found the American Red Cross in honor of the other Red Crosses established by nurses around the world. Clara Barton was a nurse. You may have heard of Elizabeth Halstead's husband, a famous surgeon out of Johns Hopkins. She was his wife and the OR nurse whose hands blistered in the operating room through the use of sterile techniques from the chemicals that were on their hands. It was through her innovation of developing and partnering with plastics companies to develop the first wear of rubber gloves that exist still with the patent today. Elizabeth Halstead was a nurse. And you may remember that in the 1950s, the number one cause of infant mortality, more children died in the first days of birth than any other cause of death of infants. It was Sister Jean Ward who identified that babies closer to windows did better than babies in the dark. And it was through her invention of phototherapy that reversed infant mortality. Today, half of us in this room can thank her innovation for being here today. Sister Jean Ward was a nurse. And you may remember that the polio pandemic, the way we used to treat patients was to keep them strapped down and quarantined and alone. And it was Sister Elizabeth Kenny who discovered that through movement and stretching that patients with polio did better. It was her innovation that has led to the foundation of physical therapy and occupational therapy and reversed patients with polio to live their lives again. Again, Sister Elizabeth Kenny was a nurse. And you may be unaware, but Mother Teresa went and trained as a nurse prior to opening up her clinics across India to care for the destitute and the dying. For generations, nurses have been making history, but our contributions have been often overshadowed. So I want to tell you a little bit about the rise of nursing in the United States that has led to the national, international models of care. In the early 1900s, women had been fighting for the right to vote in the United States for nearly 60 years. American nurses had largely stayed out of this debate until the year 1913, the day before Woodrow Wilson's inauguration. The women's suffrage movement organized the largest march for women's rights in the history of the United States, and for the first time ever, American nurses marched in that protest. It took 7 more years for the United States to vote women to have the right to vote. Many nursing leaders went to jail supporting this effort, fighting for a better future. But in 1920, women got the right to vote. And in the 1920s, something miraculous happened. Nursing became the largest economic vehicle for women's financial independence in the history of the world. In the 1920s, every single nurse owned their own company. They charged private clients for the services they delivered. At that time, hospitals were places of deplorable conditions. Only the most destitute would seek care there. But as families and surgery started to happen, families started to bring private nurses into the hospital system. Hospitals started to realize care got better, so they started to employ nurses into hospital systems. And at that time, every hospital bill in the 1920s listed out a line for nursing services for the services that were delivered. But what that meant is that women and nurses had tremendous knowledge about the revenue they generated for hospitals. Hospitals were run by men. Nurses were women. The men of the hospitals did not like how much knowledge women had about the revenue they generated for hospitals. So in the 1930s, with the development of national insurance models, they looked to capture and create a model that would capture nursing services, but not break it out on a profit and loss line from a revenue generation. So they turned to hotels, saw maids were rolled into room rates, and they rolled nursing services into room rates, forever erasing nursing value from hospital record-keeping system. Let's dive into this more.
Joining us live to talk about nurse burnout.
A national emergency.
We're never going to fix the nursing crisis until we fix the economic model around nursing. Because we know in business, if these are simply costs, we cut them. And that's what we've been doing historically to nurses for the last 100 years. So if I can step us back about almost 100 years ago, this actually has roots, very interestingly, in the women's suffrage movement. In 1913, it was trying to get women the right to vote. But what you saw in the 1920s was that nursing became the largest economic vehicle for women's financial independence in the history of the world. At that time, both physicians and nurses, they all ran their own companies. Private families would hire the nursing services and pay for nursing services directly to the lady delivered at home. Hospitals were this place of deplorable conditions, and what they found was though private families started to hire private nurses into the hospital system, and hospitals started to recognize that when they brought nurses into the hospitals, care got better. So they started to employ nurses into the hospital systems. On all of these bills that they issued, there was actually a line that spoke out nursing services that were billed on every single hospital bill in the 1920s. But what that meant is that nurses had lines of sight into how much revenue they were generating for hospitals. The leadership did not like that these nurses had this line of sight, so they looked to develop a model that would keep nurses as far away from the money as possible. So they looked to hotels. They saw that maids were rolled into room rates, and they rolled nursing into room rates. At that point in time, forever hiding the value of nursing services, you started to see the earliest signs of the nursing shortage actually started to exist in the 1930s when so many nurses protested this model that took away their economic freedom. This was an intentional move to destabilize the economic power that women and nurses were developing in healthcare. And 100 years later, nursing is still the only healthcare professional that cannot bill for their services. We all know that more nurses equal better care, but the reality is most of these facilities are pushing back saying we have no way to pay for that because more nurses just equal cost for us because they are rolled into room rates and we cannot afford any more nurses. So until we actually create a reimbursement model, there is no ability for us to pay for more nurses as it exists fundamentally today.
You may wonder, why is it that we as nurses constantly ask for more nursing services, but the answer to every single time that the one solution we want is unaffordable, so instead they give us more technology when we simply need more nurses? The truth is that we have reached a point and a pinnacle within the development of healthcare and technology, that the world is changing faster than our profession is keeping up. And at this time, it is going to be critical for us as nurses to recognize that if we do not want to be further erased in the forms of history, we must start documenting our profession, protecting our scope of practice, and fighting back over the changes that are happening. EHR implementation further eroded the power and voice of nursing as it created a recording system that only documented tasks for nurses at the most simple level, and everything else drawn for reimbursement. So it is time for us as nurses to imagine, where could we have been if 100 years ago they had not taken away the economic power from the profession, because it is the only profession that cannot bill for its services. OT, PT, respiratory therapy, MRIs, doulas, even mental health counselors can get reimbursed for their services, but never not a nurse. And in business, when there is no way to pay for something, there is no business. And healthcare is a business. And it is time that we as nurses learn to understand the economics around our profession so we can drive the changes we need to be sustainable. Because if we don't, healthcare is in serious trouble, not only in the United States, but globally. The truth is that there is no healthcare without nurses. Nurses are the ones, everything else can be done outpatient. OT, PT, surgery can all be done outpatient. The reason patients are in hospitals and nursing homes today is specifically for nursing care. Otherwise, we could discharge patients to hotels with an AI chatbot and wish them good luck, but it is truly the nurse who stands in that way. The truth is, in the United States, we are facing a shortage where nursing demand will outstrip the supply in the next 5 years. And the Dutch healthcare system is expressing a concern of 266,000 workers, but others are predicting a 1 million nursing shortage alone in the EU. And the one thing we cannot continue to do is to do the same thing over and over again and expect different results. That is the definition that was given by Einstein to insanity. So what I would like you to do is the next time you come forward with an idea and someone says, that's a great idea, but we can't do it because we've always done it that way. You have to say, John, but that is the definition of insanity, to keep doing the same thing over and over and expect different results. And the only way to stop this, the only way you can change it, is when you innovate. How many of you know who this person is? Henry Ford, yes. And what was Henry Ford known for doing? Making and scaling cars. So there is an old wives' tale that Henry Ford was asked, what is innovation? And he said, I cannot describe it, but let me give you this analogy. He said, if I had asked people what they wanted, they would have said faster horses. Innovation is about seeing what yet does not exist. It's about believing in the impossible until it is possible. It is about those moments of stagnation before we break through and change the future for the better. Do not be scared of it, because it is the path forward to a better future. So people ask me, Rebecca, how did you go from a community college professor to with a failed startup to doing what I do today? And it is time I share with you a bit about my story. A few years ago, I was a young nurse. My mother had given me her nursing retirement to start my first company. I had no idea how to make money, but the idea I thought was good. So I told a friend I was shutting down the company, and he said, Rebecca, this weekend there's going to be a hackathon at one of the hospitals. You should attend. And I said, Nick, what is a hackathon? He said, well, it's this 3-day event with people from different backgrounds come together, pose problems, form teams, and come up with solutions to those problems. You should go. I said, it's brilliant. I'm going to be there. Now, it was the middle of winter. A blizzard was moving in. I had 3 babies under 4. My husband, I looked at him on Friday night. I said, I'm going to this conference that was very well received. And I showed up at this room like this. And I walked in. And every major decision maker was there. The CEO of the hospital, the CEOs of all the healthcare companies in Boston, doctors, surgeons, engineers, scientists. And as I walked around the room, I quickly realized, oh my gosh, I'm the only nurse here. I'm not supposed to be here. This is where the decision makers are. But nobody asked me to leave. So I joined a team. And in those moments of that team, I started to learn more about the business of healthcare than I had ever known. And suddenly, in our group of this team that we had, opened up the doors, and the CEO of my hospital system walked in and sat down right next to me. He said, so tell me, what is the problem and the solution that you're coming up with? So the doctor at the table started speaking up, talking about the problem, how we were going to fix it on the floor. And I finally blurted out, but that is never going to work. And they said, it's not? And I said, no, if you do it that way, it is simply going to create more work for the nursing staff. We're just going to do workarounds, and it's going to be a complete disaster. And the CEO said, well, how did I not know this? And the doctor said, yeah, how did I not know this is how it worked? And I said, well, did you ask the nurses? And they started laughing. So I started laughing, even though I didn't know what was funny. And then what I realized what was funny was the idea that they should ask the nurses. But suddenly it got out that there was a nurse at this event, and everybody was seeking me out. And they're like, Rebecca, does this work? Is this a real problem? Should we do it this way? And I said, yes, no, maybe. I felt brilliant. I had never felt brilliant before as a nurse. Every time I had gone to my leader and I said, hey, I believe we should do it this way. I think if we did it this way, they said, Rebecca, it's great you think and feel that way, but can you work Saturday? I left that event learning more about the business of healthcare, but more importantly, I started to think, oh my gosh, what we need is nurse hackathons. If we put nurses in rooms with the decision maker, we could solve the real problems that healthcare needs solving. So I started to call around, and I reached MIT Grand Hack, the biggest hackathon in the United States, and I said, do you have nurses who attend this event? And they said, now that you mention it, a very small percentage of nurses attend. But almost all the winning teams in our medicine track have nurses on them. And that is when it dawned on me that nurses had the practical knowledge to create winning solutions, and I became determined there had to be a nurse hackathon. So I started to call nursing schools 2015 across the country saying there has to be a hackathon, sharing them this story. And 115 calls later, click, nurses don't innovate. Click, nurses have to follow procedure and policy. Click, nurses can't innovate. Hackathons are buzzwords. Until I connected with Dr. Nancy Hanrahan, the dean of the School of Nursing at Northeastern. I told her the story I just shared with you. And she said to me, Rebecca, next summer, I'm going to run a summit on innovation and entrepreneurship. Why don't you run a hackathon? And I thought, well, I've been to a hackathon. Sure, I'll run a hackathon. So in 2015, we started to build to this event. Now, if you look at literature, you may find a handful of articles that mention nurse, innovation, and entrepreneurship in the same article, not a single one in the same sentence. We had no idea if anyone would show up. The idea that nurses should innovate was so foreign. But suddenly, 2 weeks before the event, our event is sold out. Every major hospital in Boston is sending a team of nurses. Dr. Hanrahan calls me and she's, Rebecca, Deloitte, J&J, Microsoft are flying people in from around the world to find out what is this nurse innovation. She said, I can't just introduce nurses now to the idea of innovation and entrepreneurship. I want you to come on and be the director of innovation and entrepreneurship for the School of Nursing. And I said, well, Nancy, that's great, but what is this program going to look like? Who is doing it? And she said, well, there is no program, But the truth is we need to develop a program where nurses don't just leave nursing school with a stethoscope, but they leave with a briefcase, with the skill sets to speak across to the CFO and the COO. We no longer can just allow nurses to have seats in the audience, but I want nurses to have seats in the boardroom. And I said, what program will we follow? And she said, there is none. We'll build the plane as we fly it. And that's what we did. And over 24 months, we scaled this program to doing over 30 different events. We were invited to South by Southwest, and some of the biggest directions and companies were reaching out to understand. In that year of 2017, nurse innovation went to the top Google SEO search in the United States because everyone was wondering what this was about. And in 2017, I received a phone call from Johnson & Johnson's headquarters, who said, for the last 20 years, we have been running campaigns to thank nurses. We think that campaign is now failing. We want to learn more about nurse innovation. Come and meet us at our headquarters. Dr. Hanrahan and I went to the front of this platform, had the conversation. 2 weeks later, J&J called us and said, we are pivoting our 20-year campaign of thanking nurses to nurse innovation because we believe it is the best hope to stabilize and bring in the best into the nursing profession. As all good things happen, Dr. Hanrahan and I went and transitioned out of Northeastern, and I went on to find and found an organization called Sanciel right before the pandemic. I asked nursing leaders, the chief nursing officer of Microsoft, the chief nursing officer of Rihanna, give me your name and reputation to start a different nursing organization, to redefine what nursing looks like to the world. And 4 months later, the pandemic broke out. And living in Boston, we started to see messages that they were locking up the PPE on the nurses, and everything was going on. So we started to do this weekly meetup in February and March, and nurses were calling in as they were heading into their shifts, on their shifts, leaving their shifts, and they were saying, nobody is here. Everybody has left us. It is only us, and everything we know is failing us. You're going to have a patient walk into the ER, their pulse ox is going to be 70. You're going to intubate them. Here is how we are connecting tubing so that we can extend it from this. Here is how we are using socks to make PPE because they don't allow us as nurses to have it. And I realized nurses were innovating on the front lines of this pandemic. And in April, I called the head nurse at J&J, Linda Benton, and then I called the chief nursing officer of Microsoft, and I said, nurses are innovating on the front lines. We must do a hackathon. And in 4 weeks' time, J&J and Microsoft agreed to host the first global hackathon that we had for nurses. And this is what a hackathon looks like. When you give nurses the chance to solve the problems they need solved and give them the permission to come up with the solutions, you have created a workforce who feels heard, valued, seen, and appreciated. Through that time, we went and hosted 4 hackathons globally with nurses around the world during the pandemic. And what we saw was incredible change within our workforce. Because innovation is what distinguishes between leaders and followers. And right now, we need nursing to lead and innovate more so than ever before. So how do you make innovation happen? Ask your front line the problems that they have. Stop paying millions of dollars to consultants to ask, how do you deal with falls? How do we deal with night shift? How do you deal with a CODI? Ask your nurses. They are a wealth of knowledge to share these problems. Hackathons are when you open it up and they identify the problems that they need solved and form teams and bring together as many different people together to solve them. There is another way of something called a reverse pitch, which is you give the problem, they come up with the solution. You have a problem with falls, you ask the nurses. You will be blown away by what happens. And then bring together an innovation committee, because if you allow your nurses to share the innovations they have, the culture of your organization changes. And in the United States, we are seeing this happen. Nurses who are innovating and starting companies and are now being invited to some of the biggest healthcare conferences in the world, not to just be present, but also to be exhibiting alongside the most brilliant inventors of our time. And you being here at ICT and Health is the start of the movement to change what this country views as their nurses. And I hope those of you in the audience today who have an idea will approach your leaders and say, this is what I want to do. Because as nurses, we must start challenging the status quo. We must show up in places that we have not been before and define what our profession is. We must have LinkedIn profiles to start educating the world about the knowledge we have, not that we just hold people's hands. We can no longer remain silent when there are others writing us out of history and being invisible. And lastly, we must tackle the systemic barriers that keep us from achieving parity of our profession. And if I can tell you one thing as nurses, pay it forward. Everyone in this audience, someone else wants to be. The more nurses who rise up, the more nurses who have success, the more success our profession will have. Amplify, elevate, and encourage every nurse to follow and be better tomorrow than they are today. I'm going to leave us with one last video and one quick slide after. In 2017, Johnson & Johnson reached out to me and said, Rebecca, we can find no stories of nurse innovators across history. We've had to hire an expert in the deep web to find these stories. I had to hire that exact same expert to find the story of nurse reimbursement. And here is a testament to our history.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread. So patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand. Garbage bags and duct tape to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
This is nursing. It is those who innovate in nursing that change the future of human health. And it has been told from a long time ago by Florence Nightingale. In her journals in 1870, she wrote the following. She said, "It will take 150 years for the world to envision the kind of nursing I envision. 2020 plus 150 is this decade. It is our generation who is going to make nursing what it has always been meant to be. And it is when we innovate that we will change the future of healthcare, and I believe the future of human health." For any of those who have questions, thank you for having me. It's been a pleasure to be here with all of you today.
Rebecca, thank you so much for your energy. Thank you so much. Thank you so much. Actually, the nurse who did the treatment for polio saved my brother. We were in the hospital. I wasn't there yet, but because he's older than I was, and they lay him in the bath to move his legs and his arms. So I didn't realize that it was an innovation by nurses. So thank you for this story. And you see how important it is to write history. I'm an historian, so I feel it here. Thank you so much.
Thank you, Maria.
Rebecca, where comes that energy from?
So I think as nurses, we've also often been told that we follow the direction of others. But I actually didn't want to be a nurse. I was on my way to law school. My father's an attorney, my mother is a nurse, and she flew out after I had got my acceptance to law school, and she said, Rebecca, there are plenty of strong lawyers in the world, but as a nurse, I don't think there's strong nurses. And we need strong women and men to go into this profession to save and preserve what she felt was the strongest moral character and who would take care of anyone else if we did not have nurses. So I know some people take the directive from their parents seriously.
And you did.
I did.
Shall we ask the
Yes,
questions
please.
from the audience?
And you guys, don't be shy. What I feel in this audience sometimes is that the Netherlands holds back. We're very loud as Americans, but the truth is change only comes when you find your voice. So please, no question is stupid and ask me anything, because I've made this whole thing up as I've gone along, in all honesty, because there is no path.
And you can also do it in Dutch if you want, and I will translate it. Hello, who are you?
Hello, Rebecca. My name is Paul Rood from the Netherlands. Thank you for your amazing story. I was wondering, do you have examples of what you guys did in the States also available online so we can look into them? Because my experience is that best practices always inspire to do more.
Absolutely. So you can go to the Nurse Hack for Health website, which is still being maintained by Johnson & Johnson, Microsoft, and Sanciel, to show you how we run innovation events, or how the team now runs innovation events. And also, J&J has done a good job capturing the history of them. And we have several universities, for the first time ever, nursing schools launching innovation programs, OSU, University of Michigan, other colleges that are saying innovation is going to be part of our curriculum. And for the first time ever, magnet hospitals, which is the gold level standards of our hospitals, actually wrote an entire mandate around innovation to give people protocols to graduate their hospital system to the top level of nursing hospitals in the United States.
We have to look at which website?
So Nurse Hack for Health, I will put it back up on the screen so you guys can see. And that way, no, we won't. We'll see it in a second, and I'll share it with you so you can check that. Thank you.
Other questions? Yep. Can you stand up, please?
Yeah, absolutely.
Please. Who are
Rebecca,
you?
thank you so much for your nice story. I really love that, enjoy it. And first of all, I'm an epidemiologist. My name is Mustafa, and project manager for Health Farai Limburg. I loved your story because of the fact that in my country, I also see the discrimination between health professions and the nurses. This is the truest story that I can see it all around the world. But I have one specific question for you. Do you solely believe in nurse innovations, or do you believe in the collaboration between nurses, epidemiologists, and any healthcare provider? What do you think about that? To me, it is a package. It's not only about nurses, although I totally disagree about any discrimination. Doesn't matter. It is about race, gender, occupation, and whatsoever. So could you elaborate on that, please?
The best innovations, to your point, always come from collaboration. If you put people all of the same background in the same room to solve the same problems, guess what? You come up with the same solutions. If you put people of different backgrounds together that have never faced all those things and you give them the chance to solve a problem that matters, you come up with something brilliant. So to your point, the best hackathons, the best innovation brings together the most diversity you can possibly have, from your janitors to your porters to the most uneducated to the most educated, because the world is never seen the same way twice between two individuals. The more you can be inclusive, innovation happens best with the most inclusion. It is probably the greatest professional development and also greatest opportunity to break down barriers and cycles that we've ever had by doing those things. So bring more together, not less, and you will have more as an outcome.
Okay, thank you much. Other questions?
Can I ask you guys a question? How many of you feel that you can speak up as nurses about the problems you witness? Good. Those people, keep those hands up. How many people feel that there is a path to actually create a solution, that you would be allowed to create a solution in your hospitals? So a smaller event along those lines. That's very good. And how many of you guys feel that nurses, the perception of nursing in this country, I understand enrollment in nursing school is down 41%. Do you feel that there is an image problem around nursing in this country? Okay. I think Maria is coming with another question.
Yeah. I'm now in the middle of the room. Please stand up. Yeah.
Thank you. Thank you for your inspiring talk. I was wondering, are you aware whether such a nursing hackathon has been organized in the Netherlands somewhere?
Not yet, but I heard Belgium is thinking about it. And I mean, you have Lucy and Engelman, you have Marine right now, and I would think that it may be on the roadmap soon.
Maybe you can take the initiative.
Yes.
I will.
That's
good.
All right, that would be brilliant.
Good idea, good
Brilliant.
idea. So, are there other questions here? Because I'm standing here now and I can reach to all of you with the mic. Other questions?
If there is one thing I can tell you, is that sometimes you never believe that a small action can cause ripples and waves to change the world. But it takes the courage to step across and take the criticism and pull yourself up by the bootstraps, as we say in America, to do it. And to be honest, all the nurses that I know that have risked this have gone on to far greater things, not only for themselves, but for their entire cohort who knew them.
Rebecca, did you have ever felt resistance?
When you stand on stage, nobody talks about the resistance, how often you fail, how many people tell you that's impossible, nurses cannot do this, you are just a nurse, nobody really cares about your problems. And Rebecca, stop identifying as a nurse, you're too smart to be a nurse. The hardest thing that we need to know as a profession is it is only upon us to do the impossible. Nobody else is going to come to save us. It is upon us. So you have to decide what those no's mean, what those passions that you have are, and keep driving forward. Because at the end of the day, it is you and ultimately our profession who depends on the actions that you take.
But what type of resistance? Yeah, I want to know, because...
Okay, so what type of resistance? So,
and how then did you react?
All right, so for example, the screen I showed you of that nurse is at the group of health, right? And what had happened is this was a very famous conference around the world. Now, thousands, 10, 20,000 people attend this conference. I went every year, and every year there were people on stage talking about the nursing workforce. There were people in the audience talking about it, but there was never any nurses there. And nurses started to cringe to me, saying, why are there no nurses at this conference that costs $4,000 a ticket? So I went out on social media, because I have a rather large platform on LinkedIn, and I said, this is the problem that we have in healthcare. Every single conference is talking about nurses. They don't have nurses present. And it got to the CEO of that conference. So I got a phone call, and he said, Rebecca, prove it. Prove to me that there are nurse innovators. I'll give you a pavilion. Let me see if any will come. Not only did they come, the last health conference, nurse innovators were the #1 social media flowing content from that entire conference. What I think the resistance that you have is that we are not the decision makers. We don't have budgets, we can't purchase anything, so even though we're the end user of every product on pretty much the healthcare market, nobody seeks to create anything with us, just for us. So what I have to say is you're going to have to get uncomfortable. You're going to have to walk into places where you are going to feel unwanted and, even worse, unseen.
You have to walk into the boardroom.
You do. I guess I am lucky now that people like you all invite me to places like this, because I feel often more of the outsider than I have ever felt the insider. And even though this may look like success to some, it still feels like a battle far from being won.
Thank you so much.
Thank you, Maria. Thank you, guys. Thank you, guys.
Rebecca Love, ladies and gentlemen. Thank you for being here. Thank you for being here.
Thank you, guys.